Question 1. Public health law and ethics. Which of the following ethical principles in public health supports the idea that policies should aim to do good, improve public health, and promote well-being? A. Autonomy. B. Justice. C. Beneficence. D. Non-maleficence. Answer: C. Beneficence. Explanation: the principle of beneficence refers to the obligation to act in ways that promote the well-being of individuals and communities, ensuring that the benefits of actions outweigh any potential harm. It supports policies that seek to do good and improve public health outcomes, such as creating health programs that benefit the most vulnerable groups. Autonomy emphasizes an individual's right to make their own decisions, may sometimes conflict with public health initiatives if individuals' decisions harm their own health. Justice calls for fairness in the distribution of health resources and services, but does not explicitly focus on maximizing benefit. Non-maleficence involves minimizing harm, which is important, but it does not require promoting well-being to the same extent as beneficence. Understanding this principle is crucial when developing ethical public health policies or programs, as it aligns with the goal of improving population health outcomes. Question 2. Scenario-based question: maternal and child health. Mr. Thompson, a public health administrator, is responsible for overseeing a new prenatal care program in a low-income neighborhood. The program is designed to reduce the rate of preterm births, improve maternal nutrition, and provide educational resources. During a community meeting, a group of local mothers voiced their concerns about the program's accessibility, as many of them barriers such as transportation and work schedules. What should Mr. Thompson do to address these concerns? A. Reduce the number of services offered to accommodate the community's constraints. B. Continue with the program as planned, as the need for prenatal care outweighs accessibility concerns. C. Work with local transportation services to provide access to prenatal care clinics for the mothers. D. Advise the mothers to find alternative ways of attending the program. Answer: C. Work with local transportation services to provide access to prenatal care clinics for the mothers. Explanation: in this scenario, addressing accessibility is crucial for ensuring the success of the prenatal care program. Working with local transportation services, option C, would be an effective solution to overcome the barriers that prevent mothers from attending the program. This is aligned with public health principles, which advocate for increasing access to healthcare services, especially for underserved populations. Reducing services, option A, could compromise the program's effectiveness, especially in addressing maternal health needs. Continuing the program without adjustments, option B, may further alienate those who cannot access it, worsening health disparities. Advising mothers to find alternative means, option D, does not address the core issue and places the burden on the mothers rather than the public health system. This solution ensures equity in access to healthcare, which is core tenet of public health. Question 3. Epidemiology. Which of the following epidemiological study designs is most appropriate for investigating the cause and effect relationship between a specific exposure such as smoking and the development of lung cancer? A. Cohort study. B. Case control study. C. Cross-sectional study. D. Ecological study. Answer: A. Cohort study. Explanation: a cohort study, option A, is the most appropriate design for investigating causal relationships because it follows a group of individuals, cohort, over time to observe the occurrence of disease or outcomes in relation to an exposure. For example, following smokers and non-smokers over time to assess the incidence of lung cancer would help establish a direct association between smoking and the development of cancer. A case control study, option B, is useful for investigating rare diseases or outcomes by comparing individuals with the disease cases to those without controls. While it can suggest associations, it is less reliable for establishing causality. A cross-sectional study, option C, assesses exposure and outcome at the same point in time, which makes it useful for prevalence studies, but it does not provide information on causality. Ecological study, option D, examines data at the population level rather than the individual level, which can be useful for generating hypotheses, but is prone to ecological fallacy, misinterpreting group-level relationships as individual-level relationships. Thus, the cohort study design is best suited for exploring causality, which is essential in epidemiological research for understanding the link between exposures and diseases. Question 4. Environmental health. Which of the following is the most effective strategy for addressing the public health impact of air pollution in a metropolitan city. A. Improving individual respiratory health through targeted health campaigns. B. Increasing monitoring of air pollution levels without taking further action. C. Implementing regulations to limit industrial emissions and promoting the use of clean energy sources. D. Encouraging individuals to stay indoors during periods of high pollution. Answer: C. Implementing regulations to limit industrial emissions and promoting the use of clean energy sources. Explanation: the most effective strategy to address air pollution at a public health level is to implement regulations aimed at reducing the sources of pollution, such as limiting industrial emissions and promoting cleaner, renewable energy sources. Option C. This approach targets the root cause of the problem by reducing the pollutants in the environment, thereby benefiting the health of the general population. Improving individual respiratory health, option A, through health campaigns is important but does not address the underlying environmental issue of air pollution. Increasing monitoring, option B, is valuable for tracking air quality but without intervention, it will not reduce the pollution itself. Encouraging individuals to stay indoors, option D, is a short-term solution that helps protect individuals temporarily, but does not address the systemic issue of pollution. Public health interventions must aim at the root causes of health issues for long-term and widespread improvements. Question 5. Biostatistics. In a study comparing the effects of a new drug on blood pressure, researchers find that the p-value is 0.4 and the 95% confidence interval for the mean difference in blood pressure is negative 0.3 to 5.8. Which of the following conclusions is most appropriate? A. The drug is definitely effective, as the p-value indicates statistical significance. B. There is insufficient evidence to conclude that the drug has an effect, as the confidence interval includes 0. C. The drug is effective, as the confidence interval does not include 0. D. The drug has no effect on blood pressure, as the p-value is greater than 0.5. Answer: B. There is insufficient evidence to conclude that the drug has an effect, as the confidence interval includes 0. Explanation: a p-value of 0.4 indicates that there is a statistically significant difference between the two groups, since it is less than the common significance level of 0.5. However, the 95% confidence interval includes 0, 0.3 to 5.8, which means the true mean could be 0, indicating no effect. This suggests that, while the result is statistically significant, the evidence is not strong enough to conclusively state that the drug has a meaningful clinical effect on blood pressure. Option is incorrect because the p-value alone does not guarantee a clinical effect. It only indicates statistical significance. Option C is incorrect because the confidence interval including 0 implies the possibility of no effect. Option D is incorrect because the p-value is below 0.5, suggesting statistical significance. This scenario illustrates the importance of considering both p-values and confidence intervals in drawing conclusions about treatment effects. Question 6. Health systems and policy analysis. A public health official is analyzing the healthcare system in two countries. Country A, which has private for-profit healthcare system, and Country B, which has universal healthcare system funded through taxes. Which of the following is likely difference between the two systems in terms of health outcomes? A. Country will likely have better overall health outcomes due to competition in the private sector. B. Country B will likely have better health outcomes due to universal access to healthcare services. C. Both countries will likely have similar health outcomes, as healthcare quality is not affected by the funding model. D. Country will likely have worse health outcomes due to lack of regulations on healthcare providers. Answer: B. Country B will likely have better health outcomes due to universal access to healthcare services. Explanation: a universal healthcare system, option B, such as the one in Country B, typically provides equitable access to healthcare services for all individuals, regardless of their income or social status. This access reduces health disparities and allows for early intervention and preventative care, leading to better overall health outcomes. Population option is unlikely to be true because while competition in a private healthcare system might improve certain aspects of healthcare quality, it does not guarantee equal access for all individuals, which can lead to disparities in health outcomes. Option C is incorrect because health outcomes are significantly influenced by the structure of the healthcare system, particularly access to care. Option D is incorrect because lack of regulation does not necessarily lead to worse health outcomes. However, unregulated healthcare systems often face issues with accessibility and quality for certain populations. Countries with universal healthcare systems tend to have better population health due to widespread access to necessary services. Question 7. Social and behavioral health sciences. A public health campaign aims to reduce smoking rates among teenagers. The campaign uses social media influencers who model healthy behaviors and share personal stories about quitting smoking. Which of the following health behavior theories best supports this approach? A. Health belief model. B. Theory of planned behavior. C. Social cognitive theory. D. Trans-theoretical model. Answer. C. Social cognitive theory. Explanation. The social cognitive theory, option C, emphasizes the role of observational learning, modeling, and social influence in behavior change. By using social media influencers to model healthy behaviors and share personal experiences, this campaign aims to change behaviors by leveraging the influence of role models who are relatable to the target audience. The health belief model, option A, on perceived susceptibility, severity, benefits, and barriers to behavior change, which is not directly related to modeling behavior. The theory of planned behavior, option B, focuses on attitudes, subjective norms, and perceived control over behavior, which might also be relevant but does not specifically emphasize the role of social modeling. The trans-theoretical model, option D, involves stages of change, e.g., pre-contemplation, action, and is more focused on individual readiness to change. Social cognitive theory is particularly relevant when addressing behavior through social influence and modeling, as in the case of using influencers to change teen smoking habits. Question 8. Public health practice. Which of the following data collection methods is most appropriate for obtaining in-depth information about community perceptions of a new health initiative? A. Surveys with closed-ended questions. B. Telephone interviews with random sampling. C. Focus groups with community members. D. Publicly available health statistics. Answer. C. Focus groups with community members. Explanation. Focus groups, option C, are the most appropriate method for obtaining in-depth, qualitative data on community perceptions. They allow for open-ended discussions where participants can express their views, provide feedback, and discuss the health initiative in a group setting, leading to a richer understanding of community attitudes. Surveys with closed-ended questions, option A, are useful, collecting quantitative data but do not allow for in-depth exploration of community perceptions. Telephone interviews with random sampling, option B, can be effective for obtaining individual opinions but may lack the depth and nuance that focus groups provide. Publicly available health statistics, option D, provide secondary data but do not capture personal perceptions or community feedback about specific initiatives. Focus groups allow health practitioners to engage directly with the community and gain insights that are often missed by more structured methods. Question 9. Injury and violence prevention. Which of the following strategies is most likely to prevent workplace violence in a hospital setting? A. Encouraging employees to report incidents without retaliation. B. Providing employees with access to conflict resolution training. C. Implementing a zero-tolerance policy for aggressive behavior. D. Reducing the number of patients admitted to the hospital. Answer. B. Providing employees with access to conflict resolution training. Explanation. Conflict resolution training, option B, is an effective strategy to prevent workplace violence, especially in high-stress environments like hospitals. By teaching employees how to manage conflicts and de-escalate potentially violent situations, the workplace becomes safer for both staff and patients. Encouraging reporting, option A, is important but prevent violence. It only addresses the issue after it occurs. Implementing a zero-tolerance policy, option C, is a good deterrent but does not equip employees with the tools to handle conflict before it escalates. Reducing patient numbers, option D, may help alleviate stress, but it is not a comprehensive solution to preventing violence in the workplace. Training employees in conflict resolution is a proactive measure that reduces the likelihood of violence by addressing the root causes of aggression. Question 10. Epidemiology. A new infectious disease has emerged in a large urban population. Public health officials are conducting an investigation to identify the source and prevent further transmission. Which of the following steps should be prioritized first in an epidemiological investigation? A. Educating the public on personal hygiene. B. Identifying individuals who are most at risk of the disease. C. Establishing quarantine measures to prevent the disease from spreading. D. Identifying the source of the infection and modes of transmission. Answer: D. Identifying the source of the infection and modes of transmission. Explanation: the first priority in an epidemiological investigation is to identify the source of infection and the modes of transmission. Understanding how the disease spreads and where it originates is essential for controlling its spread. Once this is identified, public health officials can implement appropriate preventive measures. Option is important, but education comes after understanding transmission dynamics. Option B is important to target the most vulnerable populations, but should follow identifying the source. Option C is a critical step, but it is most effective once the source and transmission modes are understood. Identifying the source and transmission methods is the most essential step for controlling and preventing further outbreaks. Question 11. Health promotion. Which of the following health promotion strategies is most effective in reducing high-risk behaviors among adolescents? A. Using fear-based messaging to emphasize the consequences of risky behaviors. B. Providing information through school-based education programs about health risks. C. Engaging adolescents in peer-led programs that encourage positive behavior change. D. Offering financial incentives for abstaining from risky behaviors. Answer: C. Engaging adolescents in peer-led programs that encourage positive behavior change. Explanation: engaging adolescents in peer-led programs, option C, is highly effective because adolescents are more likely to be influenced by their peers than by adults. Peer-led interventions create a sense of community and shared responsibility, making behavior change more relatable and sustainable. Option A uses fear-based tactics, which are often ineffective or even counterproductive in changing behavior, especially with adolescents. Option B is beneficial for educating about risks but does not actively engage the adolescents in changing their behaviors. Option D could encourage temporary compliance but is not a sustainable long-term solution for behavior change. Peer-led programs empower adolescents to make healthier decisions through positive social influence. Question 12. Maternal and child health. Which of the following interventions would be most effective in improving infant mortality rates in a developing country? A. Providing free prenatal vitamins to all pregnant women. B. Improving access to skilled birth attendants and emergency obstetric care. C. Distributing information about breastfeeding and infant nutrition. D. Introducing a nationwide vaccination program for infants. Answer: B. Improving access to skilled birth attendants and emergency obstetric care. Explanation: access to skilled birth attendants and emergency obstetric care, option B, is the most effective intervention for reducing infant mortality rates, particularly in developing countries. Proper medical care during childbirth can prevent many complications that contribute to infant mortality. Option is helpful but may not directly address the primary causes of infant mortality, such as complications during childbirth. Option C is valuable but not as immediate in impact as improving access to skilled care during delivery. Option D is important for preventing certain diseases but does not address the broader causes of infant mortality. The presence of trained healthcare professionals during childbirth can significantly reduce infant deaths. Question 13. Health economics. Which of the following is a key characteristic of a single-payer healthcare system? A. Healthcare services are provided and financed by private insurance companies. B. Individuals are responsible for paying for their own healthcare services directly. C. The government acts as the sole insurer and financer of healthcare services. D. Employers are required to provide healthcare insurance for their employees. Answer: C. The government acts as the sole insurer and financer of healthcare services. Explanation: a single-payer healthcare system, option C, is characterized by the government being the sole provider of healthcare insurance and the financer of healthcare services. This system aims to reduce administrative costs and ensure universal access to care by eliminating private insurers. Option A refers to a private healthcare system where private companies provide health insurance. Option B refers to a system where individuals pay directly for healthcare services, a characteristic of out-of-pocket or consumer-directed healthcare. Option D refers to employer-based health insurance, which is common in many countries but not a characteristic of a single-payer system. The single-payer system centralizes healthcare financing, aiming for equitable care for all citizens. Question 14. Environmental health. which of the following interventions would be most effective in reducing lead poisoning in children? A. Providing lead exposure education to parents. B. Banning the use of lead-based paints in homes. C. Providing lead screening to all children. D. Encouraging parents to use air purifiers in their homes. Answer: B. Banning the use of lead-based paints in homes. Explanation: banning the use of lead-based paints, option B, is the most effective intervention to reduce lead poisoning in children. Lead poisoning is often caused by ingesting or inhaling dust from lead-based paints, especially in homes built before the 1970s. This intervention directly addresses the source of the exposure. Option is important for raising awareness but does not reduce the source of exposure. Option C is important for early detection but does not prevent lead poisoning. Option D may improve air quality but does not address lead exposure from household paint or soil. Removing the source of lead exposure through regulations is the most effective long-term solution. Question 15. Chronic disease management. Which of the following is the most important strategy for managing hypertension in older adults? A. Reducing salt intake and increasing physical activity. B. Increasing the use of antihypertensive medications. C. Encouraging home blood pressure monitoring and regular doctor visits. D. Focusing on reducing weight through diet and exercise alone. Answer: C. Encouraging home blood pressure monitoring and regular doctor visits. Explanation: home blood pressure monitoring combined with regular doctor visits, option C, is crucial for effectively managing hypertension in older adults. It allows individuals to monitor their condition regularly and helps healthcare providers adjust treatment plans as needed. Option is important, but it may not be enough on its own without proper monitoring and medication. Option B is important for pharmacological management but should be complemented by lifestyle changes and monitoring. Option D is beneficial for weight management but does not fully address the multifactorial nature of hypertension. Regular monitoring helps ensure that the treatment plan is effective and that adjustments can be made in real time. Question 16. Behavioral health. Which of the following is an example of a primary prevention strategy for mental health? A. Providing therapy for individuals diagnosed with depression. B. Offering stress management workshops for employees. C. Prescribing antidepressant medication to people with anxiety. D. Conducting a support group for individuals recovering from addiction. Answer: B. Offering stress management workshops for employees. Explanation: primary prevention, option B, aims to prevent mental health issues from developing in the first place. Offering stress management workshops helps individuals manage stress before it leads to more serious mental health conditions like depression or anxiety. Option is a secondary prevention strategy aimed at addressing mental health issues after they arise. Option C is a tertiary prevention strategy focused on treating existing conditions. Option D is a secondary or tertiary prevention strategy focused on individuals already affected by addiction. Primary prevention targets the root causes of mental health issues to reduce the risk of developing mental illness. Question 17. Nutrition and health. Which of the following dietary interventions is most likely to reduce the risk of developing type 2 diabetes? A. Increasing the intake of refined carbohydrates and sugars. B. Consuming a high-protein, low-carbohydrate diet. C. Reducing the intake of saturated fats and increasing fiber intake. D. Following a low-fat, high-sugar diet. Answer: C. Reducing the intake of saturated fats and increasing fiber intake. Explanation: a diet that reduces saturated fats and increases fiber intake, option C, is most effective in reducing the risk of developing type 2 diabetes. High fiber helps regulate blood sugar levels and reducing unhealthy fats improves insulin sensitivity. Option is incorrect as refined carbohydrates and sugars increase the risk of developing type 2 diabetes. Option B could be beneficial for weight management but is not as comprehensive for reducing diabetes risk. Option D is not advisable as it includes excessive sugar intake, which can increase the risk of developing diabetes. Dietary changes that focus on balanced nutrients, especially fiber, help maintain blood sugar levels and reduce diabetes risk. Question 18. Global health. Which of the following is the most effective approach for reducing the incidence of malaria in a region with widespread transmission? A. Distributing antimalarial medications to all residents. B. Implementing a widespread bed net distribution program combined with insecticide use. C. Providing education on the symptoms of malaria and treatment options. D. offering free medical care to individuals who contract malaria. Answer: B. Implementing a widespread bed net distribution program combined with insecticide use. Explanation: the most effective strategy for malaria prevention is the use of insecticide-treated bed nets. Option B. These bed nets provide a physical barrier between individuals and mosquitoes, and insecticides reduce the likelihood of mosquitoes transmitting the disease. Option is important but does not address the prevention of malaria. Option C is helpful for awareness but does not prevent the disease. Option D focuses on treatment rather than prevention. Preventing mosquito bites through bed nets and insecticides is one of the most effective ways to reduce malaria transmission. Question 19. Nutrition and chronic disease. Which of the following nutritional interventions is most effective in reducing the risk of cardiovascular disease? A. Increasing the intake of saturated fats and red meat. B. Consuming a diet high in refined sugars and low in fiber. C. Consuming a Mediterranean-style diet rich in fruits, vegetables, whole grains, and healthy fats. D. Following a low-fat diet with no emphasis on quality of fats. Answer: C. Consuming a Mediterranean-style diet rich in fruits, vegetables, whole grains, and healthy fats. Explanation: a Mediterranean-style diet, option C, has been shown to effectively reduce the risk of cardiovascular disease. This diet emphasizes healthy fats such as olive oil, along with fruits, vegetables, whole grains, and lean proteins, all of which support heart health. Option is not recommended as it increases the risk of heart disease due to high saturated fat intake. Option B promotes poor dietary habits that increase the risk of cardiovascular disease. Option D is also not optimal as the type of fats consumed plays a critical role in heart health. A balanced, nutrient-dense diet is key for preventing cardiovascular disease. Question 20. Environmental health. Which of the following environmental factors has the greatest potential to impact public health in urban areas? A. Air pollution from industrial sources. B. Access to public transportation. C. Availability of green spaces for recreation. D. Noise pollution from traffic and construction sites. Answer: A. Air pollution from industrial sources. Explanation: air pollution, option A, from industrial sources is one of the most significant environmental factors that can impact public health in urban areas. Exposure to pollutants like particulate matter and gases, such as sulfur dioxide and nitrogen oxides, is linked to respiratory diseases, cardiovascular diseases, and even premature death. Option B is important for improving mobility and reducing carbon footprints, but is less immediately impactful on health. Option C is valuable for promoting mental and physical well-being, but does not pose as direct a health risk as air pollution. Option D can lead to stress and hearing problems, but has less severe and widespread impacts than air pollution. Air pollution in urban settings can cause a range of chronic health issues, making it a top priority for public health interventions. Question 21. Health policy. Which of the following is the primary goal of the Affordable Care Act in the United States? A. To provide universal healthcare coverage through a government-run system. B. To decrease the federal budget deficit by reducing healthcare spending. C. To expand healthcare coverage to more Americans and reduce the uninsured rate. D. To eliminate private health insurance and replace it with a public option. Answer: C. To expand healthcare coverage to more Americans and reduce the uninsured rate. Explanation: the primary goal of the Affordable Care Act option C, is to expand healthcare coverage to more Americans and significantly reduce the uninsured rate. The ACA achieves this through mechanisms such as Medicaid expansion and the creation of health insurance exchanges where individuals can purchase coverage. Option is incorrect as the ACA does not establish a government-run healthcare system but rather expands private coverage options. Option B does not align with the ACA's main focus, which is expanding access to healthcare rather than focusing on reducing the deficit. Option D is incorrect as the ACA preserves private insurance and does not eliminate it. The ACA's focus is on increasing access to health coverage while maintaining predominantly private system. Question 22. Chronic disease prevention. Which of the following strategies is most effective in preventing the onset of type 2 diabetes in at-risk populations? A. Encouraging daily physical activity and reducing processed food consumption. B. Providing free medications to those with prediabetes. C. Offering surgery options for individuals who are overweight. D. Focusing only on reducing sugar consumption. Answer A. Encouraging daily physical activity and reducing processed food consumption. Explanation. The most effective strategy for preventing type 2 diabetes in at-risk populations is to encourage daily physical activity and reduce the consumption of processed foods. Option A. A balanced diet with fewer processed foods and regular exercise helps improve insulin sensitivity and maintain healthy blood sugar levels. Option B is not as effective as lifestyle changes like physical activity and diet modification in preventing the onset of diabetes. Option C is only appropriate for certain individuals, particularly those who are severely obese. Option D is important but not sufficient on its own for preventing type 2 diabetes. Lifestyle changes, especially exercise and diet, are the cornerstone of diabetes prevention. Question 23. Global health. Which of the following is the most effective intervention to address the spread of HIV in sub-Saharan Africa? A. Providing free antiretroviral medications to all individuals with HIV. B. Promoting condom use and safe sex practices among high-risk populations. C. Providing routine HIV testing for all adults. D. Offering voluntary male circumcision to all men in the region. Answer. B. Promoting condom use and safe sex practices among high-risk populations. Explanation. Promoting condom use and safe sex practices, option B, is one of the most effective interventions for preventing the spread of HIV in sub-Saharan Africa, where high-risk behaviors contribute to the spread of the virus. Education and access to condoms can significantly reduce transmission. Option is important for treatment but does not address prevention. Option C is beneficial for identifying individuals with HIV, but it does not prevent the spread of the virus. Option D has been shown to reduce transmission, but is not as widely effective as behavioral interventions. Behavioral interventions focused on prevention are the most effective long-term strategy in combating HIV transmission. Question 24. Public health surveillance. Which of the following is the primary purpose of public health surveillance? A. To monitor the health status of populations and identify trends in disease occurrence. B. To evaluate the effectiveness of specific medical treatments for individuals. C. To provide funding for healthcare programs. D. To create national health policies based on expert recommendations. Answer A. To monitor the health status of populations and identify trends in disease occurrence. Explanation. The primary purpose of public health surveillance, option A, is to monitor the health status of populations, detect patterns, and identify trends in the occurrence of diseases. This data is crucial for informing public health interventions and preventing outbreaks. Option B focuses on individual treatment, which is outside the scope of public health surveillance. Option C is related to funding but not directly to surveillance. Option D is important, but health policies are based on surveillance data rather than expert opinions alone. Public health surveillance helps track disease patterns and ensures that resources are allocated to areas with the greatest need. Question 25. Maternal and child health. Which of the following is the most important factor in reducing maternal mortality in low-income countries? A. Increased access to prenatal vitamins. B. Providing skilled birth attendance during labor and delivery. C. Increasing public awareness of maternal health. D. Offering financial incentives to women who deliver in healthcare facilities. Answer. B. Providing skilled birth attendance during labor and delivery. Explanation. Providing skilled birth attendance during labor and delivery, option B, is the most effective way to reduce maternal mortality in low-income countries. Skilled professionals can detect complications early, provide emergency care, and ensure safe delivery. Option is beneficial for maternal health but does not directly address the risks during delivery. Option C is valuable for education but does not replace the need for skilled care during childbirth. Option D can encourage healthcare utilization but is not as effective as ensuring that trained professionals are present during delivery. Access to skilled care during childbirth saves lives by addressing complications that could otherwise lead to death. Question 26. Behavioral health. Which of the following is a key principle of cognitive behavioral therapy (CBT) for treating anxiety? A. Identifying and changing negative thought patterns that contribute to anxiety. B. Using medications to balance neurotransmitters in the brain. C. Providing a safe space for patients to relive traumatic experiences. D. Focusing on deep relaxation techniques and mindfulness exercises. Answer A. Identifying and changing negative thought patterns that contribute to anxiety. Explanation. A key principle of cognitive behavioral therapy (CBT) for anxiety, option A, is to identify and change negative thought patterns that contribute to anxiety. CBT helps individuals recognize irrational or distorted thoughts and replace them with healthier, more balanced ones, thereby reducing anxiety. Option B refers to a pharmacological approach which can be helpful but is not the core of CBT. Option C relates more to therapies such as exposure therapy or psychodynamic therapy rather than CBT. Option D refers to techniques used in mindfulness-based therapies, but CBT focuses more on cognitive restructuring. CBT is effective because it targets the cognitive processes that contribute to anxiety. Question 27. Health systems. Which of the following is the most important advantage of a decentralized healthcare system? A. More efficient management and distribution of healthcare resources. B. Greater flexibility for local governments to tailor healthcare to specific community needs. C. Easier implementation of national health policies. D. Reduced administrative costs and lower taxes for citizens. Answer B. Greater flexibility for local governments to tailor healthcare to specific community needs. Explanation. The primary advantage of a decentralized healthcare system, option B, is that it allows local governments to tailor healthcare delivery to the specific needs of their communities. This is particularly important in large, diverse populations where needs may vary significantly across regions. Option is not necessarily true. Decentralization can lead to inefficiencies due to duplication of services. Option C is more applicable to a centralized system. Option D is not guaranteed as decentralization can involve additional administrative costs at the local level. Decentralization provides flexibility and ensures that healthcare solutions are more responsive to the unique needs of local populations. Question 20. Nutrition. Which of the following is the most important dietary factor in preventing cardiovascular disease? A. Reducing sodium intake. B. Consuming more fruits and vegetables. C. Increasing the intake of animal fats. D. Reducing protein consumption. Answer B. Consuming more fruit and vegetables. Explanation. Increasing the intake of fruit and vegetables. Option B is the most important dietary factor in preventing cardiovascular disease. These foods are rich in vitamins, minerals, fiber, and antioxidants, which help improve heart health, lower blood pressure, and reduce cholesterol levels. Option is helpful but not as effective in isolation. Option C is associated with higher risks of cardiovascular disease due to high saturated fat content. Option D does not address the primary dietary factors linked to heart health. A diet rich in fruits and vegetables can significantly reduce the risk of heart disease. Question 29. Epidemiology. Which of the following best describes the epidemiological term incidence? A. The total number of cases of a disease in a population at a specific point in time. B. The number of new and existing cases of a disease in a population. C. The number of new cases of a disease in a population during a specific time period. D. The percentage of a population that is affected by a disease. Answer C. The number of new cases of a disease in a population during a specific time period. Explanation. Incidence, option C, refers to the number of new cases of a disease in a population during a specific time period. This is a key measure used in epidemiology to assess the risk of developing a disease. Option A refers to prevalence, which includes both new and existing cases. Option B describes a broader measure that also includes both new and existing cases. Option D refers to a different type of measurement but not incidence. Incidence is crucial for understanding the rate at which new cases are occurring within a population. Question 30. Public health interventions. Which of the following is the most effective public health intervention for controlling an outbreak of tuberculosis (TB) a densely populated urban area? A. Offering free TB screening and treatment for all individuals. B. Distributing masks to people in high-risk areas. C. Implementing quarantine measures for individuals diagnosed with TB. D. Providing education on the signs and symptoms of TB to the public. Answer A. Offering free TB screening and treatment for all individuals. Explanation. The most effective intervention for controlling a tuberculosis (TB) outbreak, option A, is to offer free screening and treatment for all individuals. Early detection and treatment are critical to preventing the spread of TB, especially in densely populated areas. Option B may be helpful but is not a substitute for diagnosis and treatment. Option C is important but should be combined with broader screening and treatment efforts. Option D is valuable for raising awareness, but does not directly address the immediate need for diagnosing and treating those infected with TB. Screening and treatment are critical in preventing further transmission, especially in high-density settings where TB can spread quickly.